I'm Sophia Ingmeyer, and in today's presentation, we're going to delve into Alzheimer's disease, its current treatments, and explore a promising new drug called Lecanemab. This presentation aims to provide a comprehensive overview of the disease, the challenges it presents, and how Lecanemab could potentially change the landscape of Alzheimer's treatment. To begin with, what exactly is Alzheimer's? Alzheimer's disease is a progressive neurodegenerative disorder characterized by the decrease of cognitive functions, especially memory. It's the most common cause of dementia in older adults. Currently, over 50 million people worldwide have Alzheimer's, and this number is expected to triple by 2050 due to the aging global population. There are many different factors that contribute to the development of Alzheimer's disease. Genetics play a significant role, with the ApoE4 gene being the most well-known risk factor. Environmental factors and lifestyle choices, such as diet and physical activity, can also impact it. Biologically, plaques in the brain, inflammation, and neurofibrillary tangles, as shown here, all lead to the breakdown of brain cells, causing the symptoms associated with Alzheimer's. One of the primary features of Alzheimer's disease is the accumulation of beta amyloid plaques in the brain. These plaques are protein fragments that clump together between nerve cells, disrupting their function. The exact role of beta amyloid in Alzheimer's is still being studied, but it is believed to be a major factor in the disease's progression. The symptoms that accompany Alzheimer's can be divided into 3 loose stages, with symptoms in the early stages including misplacing items, poor judgment, and mild memory loss. These signs progress to a greater degree in the middle stage, along with getting lost, increased confusion, disorientation, and changes in sleep patterns. Lastly, the later stages of Alzheimer's are where the most severe symptoms occur, such as personality changes, inability to move around, and loss of control of bodily functions. In order to test for Alzheimer's disease, physicians may use preliminary tests to rule out other potential reasonings for the symptoms, like cognitive exams, neurological exams, urine and blood tests, and MRIs. A genetic test may also be run in order to test for the ApoE4 gene, which may contribute to Alzheimer's disease. To check for the amyloid protein buildup specifically, physicians may opt for an amyloid PET scan or a cerebrospinal fluid test. Current treatments for Alzheimer's include cholinesterase inhibitors such as donepezil and NMDA receptor antagonists like memantine. These drugs can help manage symptoms, but do not completely stop the progression of the disease. They mainly address the chemical changes in the brain associated with Alzheimer's rather than the root issues, such as beta amyloid accumulation. So where does lecanemab come into this? Lecanemab is a monoclonal antibody that is administered by IV infusion and is designed to target and clear beta amyloid plaques. It is intended for patients with early Alzheimer's disease, aiming to slow down cognitive decline. Lecanemab works by binding to beta amyloid and helping to remove it from the brain. The drug is in the advanced stages of clinical trials, having completed phase 3 studies with promising results. Regarding safety, lecanemab has been generally well tolerated in clinical trials. Common side effects include infusion-related reactions and amyloid-related imaging abnormalities, which were mostly asymptomatic and resolved over time. Any serious adverse events were rare and didn't result in any significant issues. Overall, the safety profile of lecanemab appears favorable compared to other treatments for Alzheimer's. Amyloid-related imaging abnormalities, also called ARIA, can cause brain swelling and in rare cases brain bleeding, which usually are not serious and go away over time. Those with the ApoE4 gene may be at a higher risk of having ARIA. Symptoms are typically not present, but it may cause headaches, nausea, dizziness, and vision problems. Signs of ARIA are frequently monitored by physicians through MRIs. The journey of lecanemab through clinical trials began with the preclinical studies in the early 2010s, followed by phase 1 trials from 2010 to 2012 to evaluate its safety and how it behaves in the body. The phase 2b trial, conducted from 2013 to 2018, demonstrated a significant reduction in amyloid plaques and even some cognitive benefits at the highest dose. This led to phase 3 trials starting in 2019, which further confirmed these findings. In the phase 2b trial, lecanemab at the highest dose significantly reduced beta amyloid levels and showed cognitive improvements compared to placebos. The phase 3 Clarity-AD trial involved over 1,700 participants between the ages of 50 and 90 and of multiple ethnic and racial backgrounds. The earlier results were confirmed, showing a statistically significant slowing of cognitive decline as measured by the Clinical Dementia Rating Sum of Boxes, also called the CDR-SB score, which tests the progression of dementia by analyzing one's memory, ability to stay active, problem solve, and through other factors. Several key publications have detailed the findings of lecanemab's trials. Notable papers include those published in renowned journals like the New England Journal of Medicine and JAMA Neurology, which discuss the trial's results, the drug's mechanism of action, and its potential implication for treating Alzheimer's disease. Lecanemab received accelerated approval from the FDA in January 2023 based on the amyloid reduction observed in the phase 2 trial. This approval requires more trials to confirm the clinical benefits. But the drug is now moving towards traditional approval, backed by the positive results from the phase 3 Clarity-AD trial, and is currently available in limited clinical settings. As of now, lecanemab is being implemented in clinical practice, primarily through specialized Alzheimer's treatment centers, and insurance companies are moving to cover its treatment, including Medicare Part B. Early feedback from patients has been positive, with reports of cognitive stabilization and improvement. However, widespread access and insurance coverage are still developing. Despite its promise, lecanemab still faces several challenges. The cost of treatment is high, potentially limiting accessibility, and long-term safety and efficacy need further study, particularly concerning the risk of serious reactions. There are also ethical concerns about diagnosing and treating those who are asymptomatic. Research continues to explore lecanemab's effects and expand its application. Additional trials are examining its potential in various stages of Alzheimer's, including before symptoms appear. Efforts are also underway to gain approval for the drug in other countries, which could improve global access. Lecanemab could significantly alter patient outcomes by slowing disease progression and maintaining a cognitive function longer. This would not only improve the quality of life for patients and their families, but also reduce the burden on healthcare systems and possibly lower long-term care costs. Alzheimer's disease remains a serious issue, especially with older populations, making awareness and support for ongoing research necessary to keep advancing and making new treatments available. Lecanemab is a major development in our understanding and treatment of the disease, offering hope for altering its future. From its early trials to current implementation, lecanemab has shown significant promise in reducing amyloid plaques and slowing cognitive decline that come with Alzheimer's disease. While challenges remain, the potential impact on patients and the healthcare system is profound. Thank you for listening, and for further information on Leqembi and its development, the following resources are provided.